Hello, my name is Karen Paul, and I'm going to be demonstrating the NG2 insertion and removal skill. So the first thing we want to do is confirm the physician's order. So I've confirmed that we do have an order for NG2 placement for relieving stomach discomfort and pressure. So I'm going to go ahead and gather up all of my equipment. Over here, I have a washcloth and towel. I have tissue paper. I have my hand sanitizer. I have my stethoscope, my pen light, my scissors, my pair of clean gloves. I have my Salem sock tubing. I have my piston syringe. Here I have my cup with a straw, which I'll be using to provide water to my client. I have my tape. I have medicine cup with my pH strip. I have my safety pen and my rubber band, which I'm going to be using to secure the tubing to my patient. And I have my water-soluble lubricating jelly. And lastly, I have my toothbrush and toothpaste to provide my mouth care. I would also have my pillow if I needed that, but today we are not going to be using a pillow or a bed. So those are the equipments that I'm going to use using for this procedure. So once I've gathered all of my equipment, I'm going to enter the patient's room, wash my hands with soap and water, and immediately identify the patient using two identifiers. So I'm going to ask the patient to tell me their name and date of birth, then I'm going to confirm it against the ID band. And once I've confirmed that this is the correct patient, I'm going to provide for privacy. So today we are going to use the chair for the purpose of this demonstration, but if the patient was in a bed, I would raise the bed to the working level at my waist, then I would elevate the head of the bed at least 45 degrees. At a high Fowler's position, and then I would use an additional pillow if necessary to confirm that we are at the optimal level at a high Fowler's position for this procedure. So once I've gone ahead and positioned the patient, I'm going to place the towel over the patient, and I'm going to also place the tissue paper close to the patient for us to use later. Once I've done the placement, I'm going to use my hand hygiene and don my gloves. Now I'm going to assess the patient's nostril. I'm going to use my pen light to check for any obstruction in the nose. I'm going to observe the patient breathe through the nose. I'm going to ask the patient to breathe through each nose. Go ahead and breathe for me. All right, very good. Go ahead and breathe. One more time. Okay. Did you have any difficulties breathing, any trouble at all? Good. No trouble breathing. Okay, thank you. Once I confirmed that he didn't have any trouble breathing and that there was no obstruction in the nose, I'm going to go ahead and open up my tubing. Now that I have my tubing out, I'm going to measure the amount of tubing that I'm going to need for my procedure. So I'm going to do that by measuring from the tip of the patient's nose to the earlobe, and then I'm going to go underneath the towel here and underneath the gown to bring it down to the xiphoid, right below the xiphoid process. So we have the xiphoid process right below the xiphoid process. All right. So I'm measuring at 50. So So I'm going to place that here, and I'm going to take a piece of tape to mark off my tubing. Then I'm going to lubricate my tubing, and I'm going to give my patient, ask my patient to drink some water for me. I'm going to ask my patient to blow his nose. Thank you. Take another sip, small sip. You can throw that out into the trash can. Take a small sip for me. Thank you. Now I need you to hold on to the water because throughout the procedure we're going to be needing you to take small sips so that we can ensure the proper placement of the tubing. Okay, so what I'm going to do is lubricate 4 inches of the tubing with this water-soluble lubricant. Now I'm going to prepare for insertion. So I'm going to have my client, instruct my client, continue to take small sips of water. Not now, but I'm going to let you know when, okay, as I'm inserting the tubing. So I'm going to go ahead and take a look. I'm going to insert into the nostril. We're using the right nostril. I'm going to gently and slowly insert it into the nostril until I hear the patient gag. Once I hear the patient gag, I'm going to check the back of the throat to ensure that the tubing is in the back of the throat. I've ensured that the tubing is in the back of the throat, so I'm going to have the patient tilt his head towards your chin, There you go. And I'm going to need you to just take small sips of water for me as I'm advancing the tubing into your nose, okay? Very good. Very good. So I'm slowly inserting the tubing into the nostril. If I feel any resistance, I'm going to turn the tubing slowly and gently towards the closest side of the ear, the closest ear, which is on the right side. But I'm not going to force it down the patient's nostril. I'm also going to observe for any respiratory changes at this time. If the patient has any changes in respiratory, I'm going to immediately remove the tubing. So during the assessment, I'm seeing that there's no respiratory status changes and that the patient is tolerating the procedure well. So I'm going to continue to advance until I reach to my marking where my tape is right there. Once I get to that marking, I'm going to tape it to the patient's nose. Thank you. And at this time, I'm going to confirm my placement. Are you okay? Perfect. So I'm going to confirm my placement using my piston syringe. So what I want to do at this point is remove the connector. Place it to the side. I'm going to need that later. And I'm going to withdraw 30 milliliters of air into my syringe. And then I'm going to connect my syringe to the end of my tubing. Now I'm going to listen at the upper left quadrant of the epigastric area as I insert the air slowly into the tube. And I'm auscultating to listen for any bubbling or any sounds that the air is there and that it's in the correct location. So I did hear the air inserted there. So what I'm going to do at this time is draw back 10 milliliters of gastric content. Then I'm going to place the gastric content into my medicine cup. I'm going to use my pH strip to check the gastric content. And I'm going to confirm that it is less than 5. Once I've confirmed that it's less than 5, that means that I am actually in the stomach and that I'm in the right location. At this point, if it's been ordered, I would obtain an x-ray to confirm placement as well. Once I've confirmed placement, I'm going to hook up, I'm going to go ahead and remove the temporary taping and secure my tubing. So what I'll do is use 4 inches of tape, and I'm going to split that evenly so that I have 2 inches on each side. So I'm going to remove the temporary tape, and I'm going to place the top portion right over the nose. And then I'm going to use each side of the tape, and I'm going to go downwards in a spiral motion to secure it to the nostril. Once I've secured it to the nostril, I'm going to use my rubber band and safety pin to secure the tubing. To secure the tubing to the patient's gown. So we're going to go about 12 to 18 inches from the top of the tube there and secure that to the patient's gown. Once I've secured my tubing to the patient's gown, I'm going to educate the patient about movements that can dislodge the tube from the nose. So I'm going to tell him to be careful not to extend or flex the neck or do any rough movements with his head, because that can dislodge the tubing. I'm also going to educate about any changing of the gown. So I'm going to let the patient know if they need to remove the gown to call for assistance, because the tubing is pinned to the gown, and removing the gown can potentially dislodge the tubing out of the nostril if it's not done properly. Okay. Once I've educated the patient about dislodgement of the tubing, I'm going to connect to my suction system. I'm going to place my connector back to the end here, making sure that it's not on the blue end. And then I'm going to go around and place it to my suction. Once I have it connected to the suction, I'm going to turn on my suction system to whatever pressure was ordered by the physician. Usually it is a continuous low suction. So I'm going to make sure that the setting is at a continuous low suction. At this point, I'm going to observe for the initial gastric content. I'm looking at the content, ensuring that it's coming out. Then I'm also going to assess the patient. I'm going to assess the patient for any signs of nausea or vomiting or any abdominal distension. Once I'm assured that the patient is okay, no abdominal distension, no nausea or vomiting, I'm going to go ahead and provide mouth care for the patient. Provide the mouth care. Then I'm going to clean the patient's nostrils because we did have that lubricant there. And I'm going to discard that. I'm going to remove my gloves. Discard it. I'm going to wash my hands. Then I'm going to position the patient for comfort. If the patient were in a bed, I'm going to lower the bed to the lowest position. I'm going to put the side rail back up. I'm going to make sure that the patient is comfortable, but also ensuring that the bed remains no less than 45-degree angle. Once I position the patient for comfort, I am going to then document my procedure. I'm going to document the reason for the procedure. I'm going to document the tubing that was used, which was my Salem sump, and the size, which was 16. I'm also going to document the pressure that was ordered, which was the low continuous pressure. I'm going to document the drainage content. So I'm going to document the color, the consistency, the odor, and the aspirate and drainage. I'm going to document the patient's tolerance of the procedure and also the effectiveness, which the patient says that he was relieved from any pressure, and so we are done with this procedure. 2 days later, I have an order to remove the NG tube. So first thing I'm going to do is verify my order. I have confirmed that I have an order to remove the NG tube. So I'm going to gather my equipment. So for this procedure of removing, I need to ensure that I have a trash can, I have my hand sanitizer, a pair of clean gloves, my mouth care equipment, toothbrush and toothpaste, washcloth, and my disposable pad. The first thing I'm going to do is perform hand hygiene by washing my hands with soap and water. Once I've washed my hands with soap and water, I'm going to identify the patient using 2 identifiers, name and date of birth, and I'm going to confirm that against the patient's ID now. Once I've confirmed the patient's name and date of birth, I'm going to provide for privacy. Once I've confirmed provided privacy, I'm going to position the patient at least 45-degree angle. Then I am going to turn off the suction. Then I'm going to do hand hygiene and don my gloves. I'm going to explain the procedure to the patient. So, the doctor has ordered for us to remove your NG tube today. Are you excited about that?
Yeah.
Great, me too. How do you feel? Do you feel any any discomfort now in your stomach?
Mm-hmm.
Okay, it's feeling good. Great. All right, so I'm going to go ahead and remove the NG tube. Okay. The first thing I want to do is remove my tube from my suction. I'm going to place the disposable pad here. I'm going to remove the safety pad. And I'm going to remove the tape. Then I'm going to ask the patient to take a deep breath and hold it. Take a deep breath Hold it, and I'm going to remove the NG tube as quickly as possible and place it into the disposable pad and dispose. Then I'm going to provide mouth care and offer a washcloth. Then I'm going to remove my gloves, wash my hands, and position the client for comfort. The client was on the back. I would lower it to the lowest position. I would raise the side rail, and I would position the client for comfort. Once I position the client for comfort, I'm going to document my procedure. I'm going to document the removal, date and time, and the patient's time.